Developing in Evansville, a family is speaking out after they learned their insurance would not be paying for necessary intensive physical therapy they were previously told was approved. Our Emma Beck sat down with them today to learn more. Emma?
Well, Rob, when Jesse Kano was diagnosed with a rare type of Guillain-Barré syndrome last year, leaving him paralyzed, he was thrown into months of intense physical therapy to regain function. He and his wife, Kennedy, consistently checked with insurance to make sure the rehab was covered, and were told it was. But they received an email last week saying they now owe tens of thousands of dollars out of pocket. The morning of November 13th, 2024, Jesse Kano woke up paralyzed.
Our son woke up. I was going to go help with that. Threw my legs off the bed. I collapsed 3 times. So within a matter of 24 hours, I went from feeling weakness in my left hand to not being able to walk myself out of the door.
He was airlifted to Indianapolis, where he learned he had a rare form of Guillain-Barré called acute motor axonal neuropathy. Since then, he's had intense physical therapy and rehab to regain function.
Clearly, with him being completely paralyzed in a rare disease, he needed the therapy. You don't know how to walk, you don't know how to use your hands, he still can't walk now, so it was deemed therapy was necessary.
The Kano family has been working with insurance company Consociate Health, who brought in a nurse case manager through third-party company MedWatch. The nurse case manager's role was to review doctor's notes and approve or deny continued therapy. And the case manager kept approving PT sessions even after Jesse hit his hard limit of 60.
And once we reached out to them and said where to go from here, and they said we make exceptions for rare cases. So we thought, great, we're free to continue.
But last week, they learned that authorization only meant he can continue, not that insurance will cover it. They're now responsible for tens of thousands of dollars for every PT session since April.
We checked in with all the appropriate resources, his PT, the third party, and his insurance consultant at Consociate Health. And they said proceed, and 7 months later said, we made a mistake. You're responsible for this out of pocket.
When they asked insurance why they were allowed to continue, insurance said they didn't quite understand what went wrong.
So I said, if you don't understand how it works, how is the patient supposed to understand how it works, especially in the midst of trying to get better and get back to real life? And they just said, this is a big mess. And I said, I agree with that.
They say they don't know how they will cover this yet, but right now are just trying to bring awareness to the situation.
Just knowing that this happens more often than not, and it's swept under the rug, or patients don't care to really push against it. It's upsetting that that is how the insurance world works.
I have reached out to Consociate Health and have not yet heard back. The Kano family no longer works with them due to employment changes. Rob?